sometimes I've been a nurse for so long that I forget that there's some people that don't actually know what the role of a nurse is in a hospital setting. So let's chat real quick about that. So the role of a nurse in a hospital setting has a couple of different headers that everything can fall underneath. And so the first one would be patient care, like actually turning the patient, checking the vital signs, checking the blood sugar, those types of things. The second one is going to be communication and education with the patient, like letting them know what's going on, educating them on their disease process or whatever they need to know for whatever they're heading next. The next one is going to be collaboration. One of the big jobs of a nurse is to collaborate with all the different teams that are taking care of the patient. Most of the time in hospitals, this takes the form of what we call multidisciplinary rounds, where the nurse of that patient is going to be making sure that the collaboration is happening and that everybody kind of knows what's going on, whether it's dietary, physicians, the different specialties of physicians, could be speech therapy, physical therapy, just kind of doing that collaboration. But to me, the most important job of a bedside nurse in a hospital setting is going to be advocacy. And that is making sure that the patient's wishes and what they want to happen to them is actually being followed. And so it is a huge job of the nurse to make sure that what the patient actually wants to happen next is happening, because people are going to be making plans for that patient and not everybody's going to go talk to the patient. And so they may be like, hey, let's send this patient for this procedure tomorrow, and they just like put an order in to get a consent, and then everybody's moving forward like this is going to happen. And especially if it happens around shift change, you may be the first one to go into the patient's room and have a discussion with them like, hey, tomorrow you're going to go for a peg tube, and they're like, no, I'm not. And please don't make me NPO because, or, whatever it would be for that procedure, because I'm not planning to do that. And so it's our job to find out if the patient is competent to make their own decisions, and if they are, to advocate for what they wish. And if they are unable to do that, to advocate for whichever person they've designated to be their caregiver, maybe like a family member or whoever else it would be, to make sure that that person is being advocated for. And sometimes advocating for your patient is also making sure you educate them about what needs to happen next. Or, yeah, like I know you don't like that doctor's tone, for sure, I get that, but hey, listen, I'm going to advocate for you to yourself right now. And so I think that nurses have a lot of different jobs, but advocacy to me is one of the most important ones. No matter which section of the hospital you're working in, if you're giving bedside care, that's going to be one of the top roles of an